Namaskar. Greetings of the day. I am Dr. Shweta Mathur from Apollo Hospital, today speaking on the occasion of the World Toothache Day. Toothache is a very important problem that most of the Indians have faced at any point in their lives. The prominence of toothache is such that every individual, be it any stage of life, childhood, teenage, or adulthood, has made them wary of the word the dental chair. In our country, where negligence towards gum and periodontal health is a norm, the incidence of dental problems is on a great high. Therefore, it is very important to understand how to combat toothache. The first question that we encounter is, what is toothache? The word toothache can be used as a synonym to jaw pain, discomfort, extreme sensitivity, and can also be defined as a pain that occurs locally in a single tooth and the surrounding tissue, namely the gums and the periodontal bone. Also the pain that radiates to one's head, to the neck, and to the heart, and also the pain that is associated with our temporomandibular joint. All these pain can have an origin from a single tooth. So it is very important to understand what one is dealing with. A lot of people come into my dental operatory, some crying in pain and some coming without pain, but with massive swellings and lesions. To both of them, I say that we are late. Why? Because pain is a feeling or a symptom that drives a patient to a dental operatory only when the infection has percolated the vital tissues. The important thing for a patient to understand is that one should not rely on the symptom or the occurrence of pain, but look out for the sign, which can be redness, inflamed, a little bleeding from the area around the tooth, and come to the dental setup first. This is where the importance of regular health checkups lies. A regular checkup with your dentist will allay the fear of toothache from one's mind. Why the fear? Toothache can have a classification of pain which groups in all categories. It can range from grade 5 to grade 1, where grade 5 is the lowest and grade 1 is the highest sort of pain. Grade 5 can be a sensitivity issue, can be a throbbing irritation where your gums are involved, and it can range up to grade 1, where the pain can be so debilitating, can be so paralyzing that it radiates to the head, it radiates to the heart, and can be also interpreted in a wrong manner. Therefore, it is important to nip it in the bud and realize and get yourself checked regularly so that you do not fall into this trap. We have to understand how can we beat the toothache. I have named various reasons for the toothache to occur, but it can be allayed by one simple method of maintaining good dental hygiene. Dental hygiene means and involves cleaning of your teeth regularly, and not only regularly, but in the right manner. And what is that manner? That manner is not only the brushing strokes that we see in so many television ads, and we hear about so many toothpaste and a lot of things that enthrall the market, but the right way and the time. Brushing should be done as a religious practice after the breakfast. Yes, I have said it right, don't get alarmed. Brushing should be done after the breakfast and after dinner, and rinsing after every meal. I have emphasized this in all my presentations that brushing is like glorified cleaning that you do at your house. And when is the cleaning required? When you litter the place. The logic of cleaning at 6 a.m. in the morning when your eyes have not opened as well, when you have brushed after your dinner meal, what is the logic? What is that you are cleaning or physically removing from between your teeth? You haven't really had anything during your sleep, have you? Cleaning should be done after breakfast, before you trot off to office or you rush your children to school. Give them a hearty breakfast, get the brushing done, and then set them off to a healthier life. The second portion that we shall cover today is not only about habits, but why does the tooth occur and how you can distinguish before landing into a bigger trouble. The toothache can occur firstly due to a tooth decay, जिसको हम अपनी कॉमन भाषा में कीड़ा लगना भी कहते हैं. Toothache or tooth decay is the most common disease that occurs in the world. However, in India, tooth pain occurs more due to bone conditions. We will be dealing with that later on. First, the decay, because it is the rising problem of our new generation. Decays were a little uncommon in the senior generations, but as we see the children of today, we see that decay is on the rise. This is because of change of eating habits. When there is a cavity, as we call it in a normal language, a layman term, or a tooth decay, it proceeds down from the enamel, which is a non-vital layer, into the dentine and to the pulp. The moment this decay invades or percolates the vital tissues of the teeth, it lands up in pulpitis, whose common manifestation is pain. However, this pain could have been avoided. How? By firstly a regular checkup at your dentist. And if on discovering that there is a decay that has started happening, we should have got it, filled it up there itself. So precaution will always keep you safe. If, however, we have missed it, the only way of now relieving my patient of this severe toothache is to now perform cleansing from the inside of the tooth, which is in common terms, which everyone knows is called the root canal treatment. The root canal treatment removes all the infection from the insides of the teeth and then enables your tooth to become strong again. The second reason because of which the patient experiences extreme toothache is the pain that occurs in the tissues surrounding the tooth. The tissues surrounding the tooth, namely are the gums and the bone. At times there is food entrapment, which increases if a particular tooth has been treated before and has been crowned or capped. This food entrapment may lead to periodontal bone loss. There is continuous food lodgement, bacterial activity happens, which escalates in the first half an hour after the meal. And this degradation of the bone and the calcified tissue leads to formation of bony pockets. And thus a symbiotic cycle starts between the bacteria, the infection, and leads to more bone loss, which causes more food impaction. And this pain is a dull, irritating pain, which can escalate to the entire jawbone if not treated at the right time. This toothache could have easily been avoided at a regular cleaning session at your dentist. According to the reputed health organizations of the world, normal cleansing or normal cleaning or prophylaxis as we call it is mandatory twice a year. If, however, you are unable to do it due to any other reason, at least once a year cleaning should be mandatory in every individual's life. Had we practiced this normal hygiene, the periodontal toothache could have been avoided. Our mission here at Apollo is to wipe away the toothache and give you a beautiful smile. So you have to understand our endeavors shall be complemented only when your endeavors are in sync with ours. Another kind of toothache that escalates in all proportions is when an abscess or an infection percolates the other vital tissues. It escapes the tooth and percolates the vital tissue surrounding leading to lymphadenopathies, which is namely the pain under the jawline. It escalates in the form of difficulty in swallowing. This is when we understand that the infection has spread, which originated from a single tooth, has now invaded other tissue levels as well. Again, aggressive